As a prosthodontist, we have multitude number of rewarding experiences, but the icing on the cake is bringing a smile on an old man's face. Generally, when an edentulous patient comes to our clinic, there are three ways of rehabilitation: complete denture, overdenture, and finally the all-on-4 concept. So let us discuss why not complete denture. Moving on to some limitations of overdenture. Keeping these disadvantages in mind, prosthodontics has evolved to amalgamate the concept of old and new to give a more innate experience to such patients. This is a small endeavor to introduce the all-on-4 concept. This was developed in the 1990s as a collaboration between Nobel Biocare and a Portuguese dentist known as Malo. It consists of 2 straight anterior implants and 2 posterior angulated implants and multi-unit abutments to correct the angulation. All-on-4 allows fixed rehabilitation, provides immediate function and aesthetics, and it has limited number of implants, avoiding the use of bone graft. This leaves us with a question: why angulated implants? Situations indicating and contraindicating the use of all-on-4. The investigations are: to understand this procedure, here is a demonstration on a model. Appropriate anesthetization of the patient is done and crestal incision is given from molar to molar. The flap is reflected and a 2 mm osteotomy site is prepared in the midline to receive titanium guide for all-on-4. Vertical lines on this guide the implant placement. In the maxilla, the anterior wall of sinus governs the angulation of implant. Sequential drilling is done. And implants are placed. The characteristic implant for all-on-4 is Nobel Speedy Groovy. Multi-unit abutments are placed on the implants to correct angulation. Open tray impression copings are placed over multi-unit abutments and splinted. Light body impression material is flowed around the implants and the tray filled with putty. The impression abutments are unscrewed and impression is removed from the mouth. A salient feature for all-on-4 concept is immediate loading. Steps for fabrication of provisional restoration. The indexes of the implant position are recorded on the patient's old denture using light body impression material. Holes are prepared through the denture. Healing abutments are replaced with titanium cylinders which emerge through these holes. Pattern resin is filled around the holes. Self-cure resin is used to fill the denture and palatal extension is removed and the denture is polished. These are some views of the final prosthesis. All-on-4 has thus taken the basic concept of complete arch rehabilitation beyond the conventional paradigms with its ingenious design to exponentiate patient satisfaction.